Are you constantly rushing back and forth to the bathroom even though you just went? Maybe you're dealing with that annoying post-void dribble, but what most men don't realize is that the reason this might be happening is that your bladder is not completely emptying. I'm Dr. Rena Malik, urologist and pelvic surgeon. In the next 12 minutes, we're gonna talk about why this happens, what the latest research tells us about it, and how we can fix it. Okay, well, let's start with the basics. What is actually happening inside your body? Your bladder is basically a bag that stores urine. But to pee, you need two things to happen at the same time. One, the bladder muscles have to squeeze to push urine out, and the muscles at the outlet, or like outside at the very opening of the bladder, need to open so that urine can pass through, and there needs to be no blockages there. When this coordination breaks down, either because the bladder's not squeezing well or there's a blockage, you end up with what we call a post-void residual. You leave urine in your bladder even after you think you've finished. Now, why does this happen? Well, most commonly it's due to obstruction. In men, having a large prostate or benign prostatic hyperplasia is the most prevalent or most common cause, especially after around 60. Your prostate is essentially a walnut-shaped gland that wraps around the urethra underneath the bladder. As it grows bigger and bigger, it can actually compress the passageway for urine flow. But other blockages can happen too. Sometimes it can be because you have scar tissue or maybe a kidney stone or even severe constipation. Now, this is when my patients get shocked by. When you're constipated, your rectum sits behind the bladder and it's filled with poop. And when it's packed full, it basically physically pushes on your bladder and sometimes makes it harder to empty. Now, the other alternative is that the muscle doesn't work. So over time, the bladder muscle can lose its ability to squeeze effectively. Sometimes this can happen because of other conditions like diabetes or neurologic conditions or spinal cord injuries. Or sometimes the muscle just gets weak over time because it's been blocked for so many years, been trying to push urine through, and over time it gets weak. It's just like any other muscle in your body. When it's chronically overstretched because it's not emptying over time, or it's been working so hard to empty, the muscle fibers can start getting stretched out, floppy, and they don't squeeze as well anymore. Now, certain medications can also make it difficult to pee. Antihistamines, decongestants, which are commonly over the counter. So sometimes if you have a cold and you take a medication, you might say, hey, why is it difficult for me to pee? It's because of that medication. And if you have a medication for overactive bladder, one of the side effects is that sometimes it can make it harder for your bladder to squeeze when you need it to, when you need to pee. Now, when your bladder leaves that urine behind because it doesn't empty well, that urine becomes food for bacteria. It just sits there. This puts you at higher risk for urinary tract infections. If you are a guy and you're having urinary tract infections, this is not normal. It's likely either because you're not emptying your bladder or you're having some other issue like a kidney stone. So make sure you get evaluated. Now, if you're not emptying, sometimes people don't notice this at all. Other times you might feel sort of full, or you might have leakage because of overflow. This means that like your bladder is so full that urine just leaks out because there's no more room in the bladder. So what can you do today to help you pee better? One is you can try sitting down to pee. When you sit, your abdominal muscles and your pelvic floor muscles are more relaxed. And this relaxation allows you to pass urine a little bit more freely. So how do you do this? Ideally, sit on the toilet, put your feet flat on the floor, or even better, use a footstool like a squatty potty, which I've talked about before. This makes your knees higher, and this is actually a very ergonomic position for your pelvic floor to relax optimally. You can lean forward a little bit, even place your elbows on your thighs or your knees, and this sort of helps change the angle between your bladder and your urethra, allowing it to be easier to empty. You can also take some deep belly breaths. Now, how do you do this? You take a big deep breath. Let's see your belly expand outward and let it relax and push forward. This then also relaxes the pelvic floor muscles, which allows urine to pee more readily. Once it's flowing, continue to relax your breathing pattern. Try not to push or strain, because when you strain, you're actually increasing pressure in your belly, which causes your pelvic floor to tighten up. So again, try to let it happen naturally over 30 to 45 seconds or however long it takes. Now, there are some little sensory techniques that can help some people. One is running tap water nearby, so sometimes that helps. Sometimes placing your hands under warm water or even making like a gentle whistling sound can help sort of stimulate that bladder contraction. Another option is to double void. So what that means is after you finish peeing, you feel like your bladder's empty, but you're not sure, don't leave right away. Sit either for an additional 20 and 30 seconds and like put your hand on your lower part of your belly and just apply some real gentle pressure or even just a light tapping. Sometimes this can be enough to trigger some additional bladder contractions. Or you can actually stand up, walk around, and sit back down to pee. This movement can sort of jostle the pee around so that it's closer to the bladder neck where the urine comes out of and helps you empty a little bit more. Some people might also find like stroking or lightly tickling the skin on their lower back might cause a stimulation of the nerve pathways that are connected to bladder function that sometimes helps you pee. You can also try like a little gentle rocking motion. Lean forward, then slightly back, then slightly forward again. And you can try timing your bathroom visits, because sometimes what happens is we just wait for the urge to come. And when you have a dysfunctional bladder, that urge comes quick and it comes fast, and then you have leakage. So if you try to go, whether you feel the urge or not, every 3 to 4 hours, this will prevent your bladder from getting super overfilled, which can also make it more difficult to empty, but also prevent you from having leakage. And we can't forget constipation. Guys, if you're constipated, you gotta work on it. You gotta start making sure that you're drinking enough, moving enough, getting enough fiber intake. For men, it's 38 grams a day. And if needed, get some over-the-counter stool softeners or Miralax. This can help you empty your bowels and ultimately empty your bladder. Now, I've had Dr. Kumkum Patel and Dr. Will Bulshwitz on the podcast. We've talked about constipation, so check out those podcast episodes to learn more. Now, other things that you can incorporate are daily stretches for your pelvic health. We don't often well enough relax our pelvic floor muscles, but also the muscles that are around your pelvic floor need attention too. So like your core muscles, your hip flexors, your groin muscles, these can contribute to tension and make things more chronically tight. And if your pelvic floor can't relax, you can't empty your bladder. So one is a cobra stretch. So lie face down on a mat or a firm mattress and press up onto your forearms, keeping your pelvis in touch with the ground, and arch your upper back looking at the ceiling. Hold that for 30 seconds. Make sure you're breathing throughout, and this can help stretch and relax things. You can do a hip flexor stretch. So kneel on one knee with the opposite foot planted in front of you. Keep your torso upright and gently press your hips forward while trying to reach your arms overhead. You can do this for 5 to 10 seconds and then switch sides. Happy baby pose is one of my favorites. Lie on your back, put your knees towards your chest, try to grab the outer edges of your feet or even your ankles or even behind your knees if you can't reach. And then once you have it, just rock back and forth. This allows stretching of the pelvic floor. Next up is hydration. A lot of people try to reduce how much fluid they drink because they think it might help them have less urinary symptoms. And this doesn't really work, because if you're not well hydrated, your urine becomes concentrated. And that concentrated urine is a bladder irritant, which makes you feel more urge and makes you pee more often. So aim for urine that's light yellow, like lemonade. Now, in terms of other things that can irritate the bladder, things like caffeine, alcohol. For some people, spicy foods. For some people, citrusy fruits and juices or tomato-based products, and even sometimes artificial sweeteners or carbonated beverages. So I always tell people to keep a bladder diary, and I'll actually link one in the description that you can use, that you can sort of keep track of what you're drinking and how often you're peeing and how much you're peeing, and that can help you determine, are there certain things in your diet that might be causing a problem. You can also incorporate a lot of green vegetables in your diet. These are rich in vitamin C and antioxidants like spinach, kale, and broccoli. They've actually been shown to reduce the risk of enlarging your prostate. The other thing is try to limit your fluids before bedtime. So 2 hours before bed, try not to drink very much. Just sip on water if you need to, because otherwise you're filling your bladder quite a bit before bed and you'll be up waking up. Lastly, weight loss. Weight loss has been shown, even 8% of your body weight has been shown to significantly improve urinary symptoms. So try to lose even just 8% of your body weight, can make a big difference. And lastly, if you are experiencing significantly bothersome symptoms, make sure to see your doctor, especially if they're affecting your quality of life. I mean, I see guys all the time who are up all night and they are miserable because they don't sleep, or they just can't leave the house because they need to know where the bathroom is all the time, or they're gonna have an issue. And these are real serious problems because we need social connection. We need to be able to do the things that bring us joy, especially when you're retired. A lot of these patients I see, they're retired and they're at home and they need hobbies and activities and social connection to keep them sort of connected with society. Now, other things to look out for: if you have pain with urination, blood in the urine, urinary tract infections, make sure to see your doctor or go to the emergency room if you can't pee. If you can't pee at all and you've tried a bunch of different things and nothing is working, don't delay, because it just becomes more and more uncomfortable in the emergency room when you're waiting. So get there as soon as possible so we can help you out. I hope this was helpful. If you guys enjoyed it, make sure to subscribe. And as always, remember to take care of yourself because you're worth it.